When I first heard about this mobile stuff, I was all in because, we hear all the time about patients who can't travel, and we particularly hear from Poolesville that the length of time you have to travel, and if you have to use public transportation, how just ridiculously long it is to go to get anything. And I know when I was on the council and people started talking about disparities in Poolesville, everybody scratches their head because you're looking at these houses and you're looking at it, then the new Poolesville stuff, and it's like, how do you wind up in a red zone in health disparities? And then you realize the underbelly that's up here was a whole lot of people who are not living in large single-family houses in really nice, cozy neighborhoods. There are people who struggle to make it through. There are people who, we have an immigrant community here that works on farms. That's got its own issues. But it also means that these people don't have access to health care the way most of us would like to see access to health care. So I thought the mobile clinic and the ability, particularly the importance of doing this up here in Poolesville, and thank the Poolesville people for being relentless in forcing the county to put you on the map. Seriously. Like I said, it was so easy to take what we thought was common knowledge about Poolesville and extrapolate into that, like, why are you guys asking me for this stuff? And when people realized what the reality was, it changed the way we approach this. And I made sure that we made these investments, and we've done everything from the school to projects like this. So we're going to keep doing this. It's a big day, and it reflects the kind of community we are. And I keep thinking about this. It's hard not to think about this in the context of what's happening in Washington, because I think almost everything we're going to do here violates Trump's idea of the law. We made the sanctuary list. So we're examining. They don't have a bunch of crimes yet. We haven't been indicted with anything. But apparently we're going to get a period of time to correct our wayward behavior. I can't find anything we're doing that's remotely illegal. And I want to say, from a perspective of ethics and morality, everything this county does fits with the basic core beliefs of every major religion. If people are hungry, you feed them. If they're sick, you heal them. If they're homeless, you house them. And for those all to be crimes, because we are harboring illegal immigrants who are criminals, not people who are actually criminals, just the fact that you're an illegal immigrant makes you a criminal, that we are subject to fines and imprisonment and all this other crap because we're actually trying to help human beings in the best tradition of our cultures, is just absolutely insulting. And it is amazing that they're doing this, and it's amazing there's not one single Republican. I mean, I grew up in an era when Republicans were not all that much different than Democrats. Differences on policy and money sometimes, but there were certain core beliefs. And there was a time in the Republican Party led the Democrats on civil rights and led the Democrats on women's rights. So it wasn't always like this. And it's just scary now to be dealing with people who think that helping people who are in need is a crime and that it's anti-white and it's just bad for the community. And it is disturbing to have to live in this time. And I hope it's brief. And, 4 years is too long. But it's really hard. I really appreciate the partnership and hard work that everybody does. The team, you guys who are doing this and delivering this every day, it is really great to see you. And it's nice to see smiling, happy faces who look forward to doing the work that they do. And I'm glad we have people like this in this county who want to do this. We're treating healthcare as a human right, a basic human right. It's not a privilege. We can't afford to have it be a privilege. If we had treated, for example, during COVID, healthcare as a privilege and vaccine as a privilege, we would have had a lot more deaths in Montgomery County than we did. You're in the most vaccinated county in the country that had some of the strictest rules in the country that, oh, by the way, had the lowest death rates for a large jurisdiction in the country. It had the lowest case rates. So there was method to what we did. And what we did worked. And we're going to continue to put public health first. We want to minimize the degree of infection and illness in the community because one sick person can create many sick people. And so to ignore public health issues would be a real problem for us, and we're not going to do that. We know the issues up here of geographic lack of transportation, economic challenges, and the lack of local infrastructure. The other thing is, do you still have only one doctor for God knows how many people up here?
One practice.
One practice for how many people?
Up to 20,000.
That's amazing. In modern America, that you've got a place with one practice for 20,000 people, not a good sign. We need more. This clinic is a practical solution to a big problem. I'm looking forward to maybe another one of these. I'm looking forward to a mobile dental, because that's another huge need out there in the community. And we know it provides preventive services, health screenings, and connections to follow-up care. All the things that you would get if you were going to your regular doctor or practitioner. We didn't do this alone. There's the DHHS Mobile Health Clinic team. There's the WUMCO Help, who helping with this, but really did help drive it. And so I want to thank you for that. You did the right thing. Sometimes relentlessly making people feel uncomfortable about neglect is not a bad strategy. So, and as a former community organizer, I assure you, I would have done the same thing. So thank you. I want to thank Montgomery County Service Consolidation Hubs, the safety net clinics and providers in our DHS programs and community health leaders. I just want to thank our DHHS leadership. This leadership has been so mission focused, so in the weeds on what we do to move healthcare forward in Montgomery County, that I could not be prouder of the work we do. Whether it was standing up to first Trump and then Larry Hogan during COVID, and I'll do a little secret. When I had to replace Dr. Gales, and the state said, you know, we have a co-approval here. I said, I know you do, but I'm telling you who I'm hiring. I'm hiring a health officer that if she has to choose between Larry Hogan's recommendations and medical recommendations, and the governor can go pound sand someplace. But we were not going to let this thing fall like other counties did, where we're being dictated health policy by somebody who doesn't know the first thing about health policy. It kind of sounds like at the federal level right now. But that's the kind of people we have here, people who would be willing to stand up to the state and do what's right for the people rather than do what's politically convenient. And I could not be prouder of the folks who work here. So I think this county's got a vision. We show this over and over again in many different ways. We try to create a system where people don't fall through the cracks. We know there are cracks. We've got to go out and find them, and we fill them. And the county's going to continue to invest in services that reduce disparities, promote access, and promote long-term outcomes. So thank you all very much for being here today. You picked a beautiful day. Thank you for not making me go out in the cold and rain like I did yesterday, which is a serious mistake. This is much better. So thank you.